Pastor Chooks, along with his wife, Pastor Toyin, are the lead pastors of Resurrection Life Church in Johannesburg, South Africa. Through them, God is raising an army of ordinary men and women who are transforming and uplifting the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation and uplifting of the complete man, complete woman, and wholesome families. Some of the events and programs include the Dream Achievers seminars and conferences, Kingdom Financiers conferences, marriage enrichment courses and seminars, for wives-only seminars, single ladies boot camps, limitless men's seminars. They are also the founders of the Power of Woman Academy, a group mentorship for high-impact women. They also host the annual Power of Women conferences and events. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. It's another Thursday evening, another edition of the amazing Power of Woman broadcast. Welcome, everyone. Welcome. My name is Chuck Sugohe, and I am your host together with my wife tonight. And tonight, we have a very, very special replay. Due to popular demand, we had the Ask Your Gynae session last week. And we had quite a bit of demand on that broadcast. So we are going to show it again tonight with our guest doctor, our consultant obstetrician and gynecologist, Dr. Audrey Gugu Gamedze. We were discussing fibroids. There's so much information that was given, so much that people want to know about fibroids. So we are showing it again tonight. And when Dr. Gamedze is done, I'm going to come back and I have a special announcement for you. So don't run away. As soon as Dr. Gamedze is done, I'll be back, and we're going to wrap up for the rest of the night. Well, I'm going to welcome Dr. Gamedze to share once again on the things around fibroids. I'll be back short now.
The Power of Woman Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Woman Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Woman Academy, please visit www.powacademy.co.za or for inquiries, call 064 200 1545.
Good evening, viewers. Good evening, listeners. Thank you so much, Pastor Chooks. Thank you, Pastor Toyin. And thank you to Power of Woman. Amazing, amazing Power of Woman. It's a pleasure again to welcome me, Dr. Gugu Gamedze. I am an obstetrician gynecologist practicing in private, and I love women. The reason for me being here today is again to bring insight and enlightenment to us women about fibroids. Fibroids, all the things that I hear. That's very much interesting to give and shed light about what are fibroids and what can they do to a woman, and why is it important that as women we know fibroids and we know the impact they can have in our health, in our community, and also in our spirituality. It is amazing to know that if we do not get empowered, we easily slip by. I was actually taken aback into scripture when our greatest gynecologist, Jesus Christ himself, healed a woman who had 12 years of bleeding. I'm thinking that most likely this girl might have fibroids, because she bled and did not die. If it was cancer, I'm thinking 12 years, she should have started showing some sign that there is a serious problem here. But if it was fibroids, most likely that is why she bled for such a long time. Anyway, the master himself will tell us what did he heal this woman of apart from the bleeding. Anyway, to start off with, every scientific approach starts with a definition. We'll look at what are fibroids, what causes fibroids, and what symptoms must I be looking out for. If there is any treatment, what are the treatment options that I have? Complications, do fibroids have complications? What is it that I need to be aware of? Okay, let's put things into perspective. What are fibroids? Fibroids are like growth that happen in the woman's womb. They are mostly confined to the womb, but we do get some that are, we call them ectopic, whereby now they move into tissues that are far from the womb. A relative to that one will be a fibroadenoma, which is found in the breast. By the way, it doesn't mean that if you've got those lumps in the breast, you will have them in the womb. But I'm just talking about relatives of how fibroids can be distributed in our body. So the commonest place where they affect us as women, it is when they are in the womb. What are the causes? We do not know what caused them. In medicine, once we have a long list of causes or associations, we do not know what is the cause. So the main thing that the main association where we find fibroids, it will be women of obesity. It will be women who started their periods very early. It will be women who have a family history of fibroids. It will also be women who have started their families a little bit late. But all of these are associations. When we do immunological studies, which is what I do not want to dwell in, there is an association with certain components or certain chemicals that which, when they are found in the woman, they are most likely going to cause the woman to have what we call fibroids. Apologies for that. So now, what are we going to put as the symptom profile for fibroids? Most of us do not know when we have fibroids or not. But what we commonly see is that somebody is going to present with pains. Pains can be associated with your periods. They can be associated with nothing else. They just come on their own. Secondly, somebody can present with heavy period pains or heavy period flow. The heavy period flow is associated with the period itself or even outside the period, depending on the intensity or on the severity of the fibroids. One can have heavy bleeding during the periods or heavy bleeding outside the periods. The other thing that we see is difficulty falling pregnant. That can be one of the symptoms or the presentations of fibroids. You try to fall pregnant, you take everything that needs to be taken, but still you fail to fall pregnant. Other ladies present with just intractable pain. You have this heaviness in your pelvis. Sometimes you are even constipated. On other times you are even struggling with intimacy for those who are married. I have seen a common presentation where ladies come with growth of the abdomen. That will be outside pregnancy. Even sometimes when you cannot feel the fibroids, but still you find that the abdomen or the tummy is just growing big. So those are some of the symptoms that present with fibroids. But on the womb, where are these fibroids positioned? So the structure of the womb is such that it has got the mouth, which is the cervix. It has the neck, which is the isthmus. It has the body. And on top of the body, you also have what we call the fundus, or that's the highest point of the womb. So on the womb, you can have fibroids on the cervix. The ones on the cervix, because the cervix is the one that takes the weight of gravity, oftentimes you find that they find their way out and sneak through the mouth of the womb and even check through. Those are the ones we call prolapsing. The commonest presentation with those, it will be pain. Somebody will feel like something is coming out or coming down, or pain like contractions. Those who have had children before will know how painful contractions are. And also they can present with bleeding. Sometimes if you are intimate, you see the bleeding coming through. So with those, the presentation is much easier. But sometimes they don't present with the bleeding, they just present with smell. Somebody can feel like my smell is a little bit more on the offensive side, or I can't just get myself clean. So that will be one of the presentation of fibroids. If it is on the body of the womb, depending on how far it is from the lining of the womb, it cannot present with bleeding if it is far into the muscle of the womb, but it can just present with discomfort. Hence, sometimes somebody grows fibroids and doesn't know that they are there because they don't give any problems. I've seen that more commonly with the women in the house of the Lord, where you find that you have preserved yourself, you're not sexually active, you're not having heavy bleeding or any gynecological issues, but one day you see your tummy growing big, and when you check, you find that you've got fibroids. You wonder, but how come I didn't know? How come these things have grown so much? It's because they were not symptomatic. And then if now they are growing on the outer part of the womb, they normally develop on some small branches. They will literally look like, say, apples on the tree, or like fruits hanging on a tree. We call those pedunculated fibroids. When you have that type of fibroid, it can just sit nicely inside the tummy and keep growing, nourishing itself. If it is very clever, it can even like attract some blood supply from the surrounding intestines and continue to nourish itself. Those ones rarely give discomfort, but if they do, it will be because they will have grown so big now, they are giving you weight, or they are pressing on the structures that are found inside your tummy. So now you have had this diagnosis, or you think that you have fibroids. What needs to be done now? What can I do? Is there hope that they are curable? Is it something that I'm going to live with for lifelong? Oh no. Yes, there is a lot of treatment available for fibroids. You're not going to live lifelong with fibroids if you seek medical attention. Whilst I'm there, actually, Pastor Chooks, I feel I must bring it to the attention of our viewers and listeners that that is where your checkups come into place. The reason why we encourage ladies to do checkups at least once a year, it is so that if there are new developments in the body, they are picked up on time and management is done whilst it is still at an early stage, where we can institute conservative management, or if we do need to institute a little bit more radical management, but we still preserve fertility and we still preserve the functioning of the woman. So now, what is the treatment that can be done? Like good students of my class, you know that I always like to make things very, very simple. There's always 3 ways we can manage things. We can do nothing, which is expectant management, where we just keep on observing. 2, we can be conservative. Conservative means that we are giving you medical treatment and monitoring the severity, monitoring your response. Number 4, it is invasive or surgical management in our case. So surgical management can involve cutting minimally or cutting wide open cuts. And then the last one is radiological intervention. Let's dive into each one of them and see what does each one mean and when do we do that. Number 1, for the expectant management, let me make an example. It's a 23-year-old lady. She's not married. she's not planning to get married anytime soon, mommy encourages her. Now you are a big girl, please go and do your checkups. When she comes for the checkup, I find that there is a fibroid. For that little girl, all I'm going to ask, do you have any symptoms? Is it bothering you in any way? Most likely she will say no, because mommy just asked me to come and have a checkup. So for that person, all we do is let's stick to yearly checkups and monitor your symptoms if there are any new developments, and then at the rightful time when something needs to be done, then we can take. So now that we know that there is nothing bothersome for this little girl, then we just observe it. That is expectant management. We are very lucky that as Amazing Power of Woman, we will be having a session of ask and answer. That is going to help us now dive into details before you see your gynae, of course, so that we have a broader understanding of what we mean with each. Then the conservative form, that one applies to a lady. Say she knows I've got fibroids, and I know that the fibroids can affect my fertility. I do not have any symptoms. I'm not bleeding heavy or having any pains, but I know that my fibroids are there. Then for that lady, we can choose, okay, to stop them from growing bigger, let's rather use some hormone manipulation like the depot injection to shrink them. But even in that case, we are not operating. Or say, you say as a lady, you know what, Dr. Gamete, these fibroids are bothering me, but I'm scared. I'm not in the right space to make a decision about them, or I still need to consult with my parents, or I need to consult with my partner. In that way, we say, what is your dominant symptom? If the dominant symptom is pain, let's control the pain. If the dominant symptom is constipation, let's do something that will relieve your constipation. If your dominant symptom is heavy bleeding, let's rather manipulate your system such that the bleeding is under control. So that is what conservative or medical treatment will do. In some ladies, let me make an example of somebody who is in their 40s, approaching their 50s. We know that fibroids do get better when you approach menopause. So what we do is we give injection that will suspend the bleeding, or that will suspend the cycle for a while until you transit gracefully into menopause. Conservative management is very nice. It actually gives you time. It buys time whilst you make, you clear your mind, or whilst you raise finances, if there's finances, or whilst you wait for a readily available slot where you can be assisted. Then surgical management. Surgical management, like I have said, involves cutting now to literally take out the fibroids. We can cut to take out the fibroids. We can cut to take out the entire womb. This is achieved in various forms. There is what we call endoscopic surgery, which is laparoscopy, where it's just small fibroids that can be taken out, or large enough to be crushed out as they are exited out of your body. The other form is when we cut open, like when we take out a baby, deliver the fibroids one by one. I like to use the word scoop them out, because we just scoop them out one by one, and then we sew the womb back. In that way, the symptoms of the fibroids are controlled. There is one area that I want to highlight about the surgical management. What we like to have in mind is your desire for reproductive health. So if you do not have babies, any surgeon who puts a knife on you, or who goes for surgery with you, must have it in mind that that womb must be able to carry babies. So damage to the fallopian tubes needs to be taken care of so that you can be able to fall pregnant spontaneously. But in cases where the overall setup inside is completely distorted, in that way we need to advise for trying to fall pregnant outside or with assisted reproduction. And then, so we can scoop up the fibroid. That is called myomectomy. I love you, my viewers and listeners, because you are so well versed with these procedures. So I am so looking forward to my question and answer session, where we will have actually an interactive session about how we can treat ourselves of fibroids. And then the last mode under surgery is the actual taking out of the womb. So I've seen ladies coming to me and saying that my gynae or my healthcare provider has suggested that I take out the womb. Let me be honest and say, it is always at the discretion of both the patient, which is you in this case, and your healthcare provider about what needs to be done. In modern healthcare, we do not impose on our patient what needs to be done, but we always discuss what will best suit your needs and what will best give us a good outcome. So please do not be pushed into a corner to say you need to take out your womb. Sometimes patients feel like, but the doctor will neglect me if I don't agree to what she wants. You have an option, and you have a chance also to seek a second opinion. Okay, let me park there so that I make it very interesting for our question and answer session. Then the last method of treatment is radiological. The consumption is still upcoming in our South African setup, but yes, it is available. Number one, there is a procedure that is called the HIFU. HIFU is it's a high resonance ultrasound waves that are used they direct them over the fibroid, and then it gets its structure sort of gets crushed. I'll put it like that blatantly. I'm not gonna get into the technicalities. So that is available, but also it's about the size, it's about the position of the fibroid. Though the procedure of HIFU does not take out the fibroid, the intention is to shrink it over time. So once it's been crushed in its structure, then it will be able to not to take from the blood vessels surrounding it. When it doesn't do that, it will stop growing. That's how I can grossly put it. Then the second one is embolization. So it's called uterine fibroid embolization. With that, the radiologist tracks the blood flow to the fibroid and then blocks it with small micro beads. So those beads stop the blood flow to the fibroid, and hence the fibroid starves and it shrinks. So that procedure as well, that procedure as well does not take away the fibroid. It shrinks over time. So how do I know which procedure suits my needs? I can tell you now. You can go through them one by one, step by step, in whatever order. It does not affect your outcome. The end result outcome. The important thing that you should know about approach to any of these interventions procedures is that it must be well discussed, well deliberated, so that you make an informed choice as a child of God or as an amazing woman. Then how do fibroids actually complicate? If I get to a doctor and the doctor said your fibroids are complicated or your life is complicated by fibroids. Number one, we spoke of heavy bleeding. That can result in anemia. There's ladies who have never had their hemoglobin above 9, above 8. You are constantly fatigued, you're constantly irritated, you're constantly feeling drained. You don't know whether is it work, is it because you don't sleep a lot, is it children? Anemia. Anemia of blood loss is a common complication of fibroids. Number two, it can be pressure symptoms. The pressure, if it's coming from the top to the bottom, you can have the actual womb coming out. We call that prolapse. We can have the actual fibroid coming out. It is called prolapse. You can have constipation because of the weight on your rectum. You can have inability to hold your pee because of pressure on your bladder. You can have recurrent bladder infections because sometimes you find that the position of the fibroid makes a ball and a socket on your bladder. So as you are emptying your bladder, the fibroid rolls, and then it changes the angle at which the bladder is supposed to empty itself. When that effect happens, you find that you've got a lot of bladder volume that you keep after you've passed water. That results in recurrent urinary tract infections. Then you can also have what we call infertility or difficulty falling pregnant, simply because the fibroids are either taking the space where the baby is supposed to sit, or they are blocking your tubes, so you cannot have the sperms, you cannot have the egg moving in the space. Also, if they share the space where the baby is supposed to sleep, you can have what we call recurrent miscarriages. If you survive the recurrent miscarriages, you can go up and have what we call preterm deliveries, because as soon as the baby grows bigger, the fibroid also is growing bigger, and they start pushing and sharing and competing for the space. So that is one of the horrible, horrible side effects or complications of fibroids. And some people think that fibroids are cancerous. No. By definition, they are just non-cancerous tumors or growth. So we have a small percentage of fibroids that can change and become cancerous. Some literature put it in 1 in 500 women with fibroids will have them becoming cancerous, but that change is very, very rare. To those whom it happens, it is associated with the size of their bodies. So, but oftentimes I can qualify and say fibroids are not meant to be cancerous. Can fibroids move from one position to the other? I have said that yes, we can have an entity of ectopic fibroids, but they will still be within the sphere of your tummy, and either they lose the blood supply from the womb and they get carried away with the blood supply of your intestines. Remember, intestines are forever moving inside the tummy. That can result in ectopic fibroids, but still the treatment of those fibroids is the same. So can I summarize so that I still look forward to our discussion? If I tell you everything now, you won't answer me, ask questions from me, and you won't be willing to meet with me when we have our open question and answer session. So in my summary, I'm gonna say fibroids are very common, and they are a threat to our fertility. They are a threat to the life of women in general. And also, fibroids are a curable occurrence. If we pick them up on time, we can treat them without leaving significant markers on your body that you had fibroids. If they are big enough or too big, according to your definition, although I don't think there's fibroids too big to be cured, there is still something that can be done. If you have fibroids and you are scared of going to seek medical attention because somebody has said that your womb will be taken out, can I say, please make time, come see us so that we can assist you. We have the number on the screen where you can contact us, and you'll get the details on how to get hold of Dr. Gametse, who is the gynecologist speaking to you now. Then we will be able to assess and find out which method of treatment will suit your needs. So in your list of intervention, take removal of the womb to be last at the bottom of your list. To the amazing women, we are empowered. Let's call it an empowerment. the amazing power of the woman, fibroids can be cured. Pastor Chooks will come in one day and discuss with you what is the spirituality around this. Is it the heel that was said the serpent must found? And how do we as women find the head and hit the serpent? God bless you.
A big thank you to Dr. Gamedze for really shedding light on this issue of fibroids. There's a scripture that says that whatever is not planted by my Father shall be uprooted. I don't believe that fibroids come from God. It doesn't come from God. And if it doesn't come from God, then it's one of those things that is not planted by the Father that shall be uprooted. I do believe there is a place of prayer. A lot of people, a lot of women who are afflicted by this affliction of fibroid, we're going to be praying for you. We're going to be standing with you in prayer. We've had a number of people send messages in to say, I've been booked in for surgery and I'm so scared to go. I've been booked in for surgery. I don't have the money for it. I've been booked in for surgery, those kind of things. So we want to take some time out to pray for everyone who has been affected by fibroid or who is, having to deal with fibroids currently. We're going to be having a session and there's going to be a Zoom session where Dr. Gamedze is going to answer your questions. The date for that Zoom session, we're going to confirm. All you need to do right now to indicate your interest for that session is to send a message to our WhatsApp number +27 81 421 0835 or the BIT link that you see on the screen just now. Send a message there and say, I am interested in the question and answer session via Zoom. And then the Zoom login details will be sent to you. During that Zoom session, we are going to take time out to really pray, to really release the power of God to uproot things that were not planted by the Father. Things that are growing in your womb, things that are growing in your body that were not planted by the Father will be uprooted in the name of Jesus. So we want to encourage you, share this broadcast with as many sisters, as many colleagues, as many friends, as many colleagues around you, people around you, women around you, that need to know about fibroids, and then let us gather together on the day that's going to be announced for those who show interest, and we're going to gather together to take questions. Dr. Gamedze is going to take questions, and then we're going to pray together and rebuke that thing from the roots. Hallelujah. God bless you. Once again, thank you for joining us tonight, and a big thank you again to our Dr. Gugu Gamedze for sharing with us and shedding light on the issue of fibroids. We look forward to hanging out with you at the question and answer session on Zoom in the next week or two, whenever we announce that is going to happen. So all you need to do, once again, send a message to +27 81 421 0835 or the BIT link on the screen, and we will get back to you with the login details for the Zoom session. God bless you. Good night. I'll see you at the Zoom session.
The Power of Women Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Women Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za or for inquiries, call 064 200 1545.